Hello and welcome to this installation of Boot Camp on the Go. My name is Susan Griffiths and I am one of the NCLEX Success Specialists. During this presentation, we are going to dive deeper into the category of reduction of risk. Let's get started. Reduction of risk potential is a key category under the physiological integrity client needs domain. Today, we're going to walk through essential nursing actions and clinical judgment strategies to help reduce client risk, prevent complications, and prioritize safety across various care settings. This category evaluates your ability to prevent complications related to a client's condition or prescribed treatments. We're going to look at changes in vital signs, diagnostic test interpretation, and how to monitor for emerging or expected or potential complications. As a practical or a vocational nurse, your role includes checking, monitoring, and interpreting vital signs, not just in isolation, not just one time, but always comparing those back to your client's baseline readings. You need to be prepared to identify abnormal values like hypertension, bradycardia, or fever, and then you're going to reinforce patient teaching on those findings. You are going to need to know how to do all of these things: perform, collect, and monitor common diagnostics like an EKG or an ECG, blood glucose, and oxygen saturation. You need to be able to reinforce client education. We always say reinforce for the PN or VN because you never do the initial teaching, but you can reinforce that teaching. The initial teaching will be done by an RN. But reinforce that client education, recognize abnormal results, and notify the healthcare provider when necessary. Just like with vital signs, laboratory results or values are always compared either to the client's baseline, where they were when they came in, or their baseline, or to normal laboratory values if you don't have a beginning point for your client. You need to be able to perform venipunctures for blood draws, blood glucose monitoring, urine and stool samples, sputum samples. You're going to maintain central venous catheters and always, again, reinforce that client teaching on the purpose of the lab test. You can tell them about the lab test, but they always need to understand, yes, I understand the lab test itself, but what is the purpose? You're going to monitor any diagnostic or laboratory test results and, again, identify your healthcare provider as needed. Knowing how to recognize when a client is at risk for poor circulation or a neurologic compromise is essential to your nursing practice and to the safety of your clients or patients. You're going to perform focused assessments such as neuro checks and circulatory checks. These are considered crucial focused assessments, again, for your client safety. You're going to monitor all outputs, reinforce teaching about managing chronic illnesses, and apply preventative tools like those SCDs, which is sequential compression garments or devices. When talking about potential complications, your goal is always to anticipate the complication based upon which diagnostic procedure or treatments your client has received. If you are anticipating complications, you are more likely to recognize and find them quicker and be able to intervene more appropriately. You need to maintain tube patency, monitor for suction effectiveness, and evaluate those O2 saturation levels. Again, always notifying your provider for any red flag findings. These would be things like a fever or suspected or known thrombus formation. As the PNVN, you will be involved in pre-op and post-op care. During these times, you're going to monitor your patient or client responses and educate on post-procedure care, things like turn cough and deep breathing, or wearing those SCDs or elastic stockings. If your client is not improving, your role is to suggest changes based upon the response to the care, and you suggest those changes to the other members of the healthcare team. Practical and vocational nurses must be able to safely insert and maintain NG tubes, urinary catheters, and if you have the appropriate certification, also IVs. You may assist with invasive procedures and then help educate the clients throughout the process. They've already received education on the initial procedure and what that's going to entail, but you may have to prompt them along the way, and that just as a reinforcement of the education that they have already received. So let's apply what you have learned to a clinical scenario. I am going to help guide you through a case study. On the NCLEX, you will have at least 3 case studies, so it's very important for you to understand case studies, understand what all is included in a case study, and be able to answer them appropriately. While it is possible, it is very difficult to be successful on your NCLEX if you are not successful on your case studies. In this case study, you are the nurse caring for a 72-year-old client admitted 3 days ago for a left-sided ischemic stroke. Please take a picture of this slide as you're going to need this information for the next set of questions. On the NCLEX, you do not have to take pictures. You can't anyway. You won't have access to your phone, but the information will transfer from slide to slide for you so that you have it. You also will have a dry erase board, and you can make notes as you're reading the initial information on the case study. You can make notes on your dry erase board that you feel like are important or appropriate for you to reference. Your case studies will consist of 6 questions. Each of those questions are trying to get you to do or recognize something very important. On each of these slides, you will see what type of question it is. This is the same order for all of the case studies. Your first question is always all about recognizing cues. The case study question types, if you will, follow along the nursing process. So while you do your assessment, if you're actually in front of a client, assessing is all about recognizing cues and analyzing cues, figuring out why those cues matter or if they matter. This first question is all about recognizing cues. Many times, not always, but many times, the first question will be in the form of a highlight. So you can see it says highlight all findings that indicate the client is at risk, increased risk for complications or injury. Everything that you see, you can determine, do you want to highlight it or not? Now, not everything is highlightable, but if it is, as you kind of scroll over it, it will turn yellow or another color indicating that that section can be highlighted. Doesn't mean that you need to, means you need to determine, is that an important piece of information or not? I recommend, as we are going through these case studies, that you pause the presentation on the first of each slide question, because the next slide after this is going to give you the answers. It is very important that you learn how to appropriately and correctly work through case studies. On your NCLEX, you will have 3 case studies. It is crucial to you passing the NCLEX that you answer those case studies correctly. Again, 3 case studies, those are 3 that are scored. You might end up with 4 or 5, but those additional case studies are in those uncounted or test items. So if you do not now possess the ability to be strong in answering your case studies, I encourage you to make sure that you are practicing those. While it's not entirely impossible, it is very, very difficult to pass the NCLEX if you are not successful on your case studies. If you need to take a picture of this slide for reference on the following slides, please feel free to do so. On the NCLEX, you will not be able to take a picture because you do not have access to your phone. However, important information will follow along from slide to slide. In addition, you will also have a whiteboard, a dry erase board that you can take notes on, and you can write down information that you feel like is going to be very important for you to know from slide to slide on your case study. So again, I encourage you to pause the slide, look at it, because the next slide is going to provide the answers to these questions. So make sure you have answered this question for yourself before moving on to the answer slide. As promised, here are the answers. So what you should have highlighted was confused, right-sided weakness, attempts to get out of bed, NPO with swallowing issues, Foley catheter in place, and on warfarin. These all show that they have potentials towards complications. So again, you were to highlight the client findings that increase their risk for complications. All of these things indicate or point towards potential complications in the future. Question number 2 of the case study is all about analyzing cues. So question number 1 is recognizing the cues. What do you see that could be an issue? And then question number 2 is always saying, okay, you've recognized the cues. Now, what do they mean? What are they in question number 1? What do they mean in question number 2? So you can see this says, based on the current assessment, which complications is the client most at risk for? And it's a select all that apply. I know these are everyone's favorite questions, haha. In select all that apply questions, you need to turn each answer option into a yes, no, or a true, false statement. So, based upon complications that my client is at risk for, would they be at risk for a fall injury? Would my client be a fall injury risk? Okay, so you look at the answer option and then make it fit into that question. Does it answer the question? Is your client a fall risk based upon everything that your current assessment of them? And again, hope that you took a picture of that or you have notes on it. Is my client at risk for aspiration pneumonia? Is my client at risk for a CAUTI or a catheter-associated urinary tract infection? Anything that is yes, if it's positive, if that's the way that the question is going, or if it's helpful to your client, you're going to keep it. So in this case, if it answers yes, if they are at risk for this complication, that's a yes, you're going to keep it. If it's no, if you say nope, they're not a fall risk, they don't have anything, then you throw it out. So you turn each question of a select all that apply into a yes, no, true, false, helpful, unhelpful, and answer those questions. Keep anything that falls into that yes, that positive, that's helpful for your client. Throw away anything that does not answer the question, that doesn't pertain, that is harmful to your client. So let's identify those risks. This client is at risk for fall injury, aspiration pneumonia, that CAUTI or catheter-associated urinary tract infection, and dehydration. All of these stem from the impaired mobility, the NPO status, the catheter use, and the confusion. Okay, hemorrhagic shock and hypoglycemia are less likely given the current findings. So again, it always goes back to what is your assessment? What have you been told in the beginning or additional information that comes along the way? But right now, these are your risks. fall injury, aspiration pneumonia, CAUTI, or catheter-associated urinary tract infection, and dehydration. Question number 3 of a case study is all about prioritizing hypothesis. So you've recognized your cues, you've analyzed your cues. Now you have to come up with what might be going on. In this particular question, you are asked to identify if each finding requires immediate intervention or ongoing monitoring. So in this table, it's either or. It's either immediate intervention or it's ongoing monitoring. Not all tables will be like this. Some tables you will select or could select 2 or 3 choices on one line. So in other words, you could say client tries to get up alone and it might have 2 choices. In this particular one, it's either or. So you either need to immediately intervene if your client tries to get up alone, or you do ongoing monitoring. Okay, so again, pause here, answer each question before you move on to the next slide. Okay, so here are your answers. Again, you needed to decide which required intermediate or immediate intervention or ongoing monitoring. So an attempt to get up out of bed where it says the client tries to get up alone, that is urgent and that needs immediate action. That client is going to hurt themselves if they try to get up by themselves. So we need to immediately intervene. Foley catheter on day 3, no UTI symptoms. That's good. We can continue to monitor that. Client received warfarin today. It is not saying that they are in trouble. It's not saying that they have any side effects or anything. So we'll just continue to monitor that. Bed alarm not functioning, that requires immediate intervention because again, this client is a fall risk. So you can see it's an either or, it's not both. Okay, now if it had said Foley catheter day 3 with UTI symptoms, that then would have been an immediate intervention versus an ongoing monitoring. So always pay attention to exactly what is said. Do not add to and do not take away from any question. Question number 4 is always all about generating solutions. So question number 1, recognize cues, and then you analyze cues, and then you generate hypothesis or come up with what might be wrong. Now, what am I going to do about it? So you're going to generate those solutions. In this particular question, you are asked to, it's a fill in the blank. So you're dragging the words from the word choice box to the blank to fill in the sentence. You can only use each selection one time. So it will not answer multiple different questions. It's one. So if you choose option number 1, which says assist with frequent position changes, if you choose to have that complete the second question, then it's gone. So again, while you're answering this question, I encourage you to make note of the options that you have selected or that are already taken so that you don't try to use them again. Again, on the next slide, I'll show you the answers. Okay, so you can see the correct answers here. So let's just read these complete sentences now. To reduce fall risk, the nurse should activate and test the bed alarm system. To prevent complications of immobility, the nurse should assist with frequent position changes. And to minimize catheter-associated infection risk, the nurse should notify provider to discontinue catheter if not needed. Excuse me. So you can see again, each answer option was used only one time. You will always have more answer options than what is needed. Step number 5 or question number 5 then is all about taking actions. So again, as a review, question number 1, recognizing cues. Number 2, analyzing cues. Number 3, prioritizing hypothesis. Number 4, generating solutions. Now we're going to take everything that we've done and figured out and we're actually going to do something. So we're taking action. This question is an order question. So you will see a list of options and you need to put them in the correct order. So this says order the following nursing actions from first to last. Be sure you pay attention to what order you are supposed to put them in. It can say first to last. It can say last to first. So make sure you are paying very, very, very close attention to that. Because if you put them in the right order, but you start at the wrong side, so you start with the last and you go down to the first, you're going to miss that question even if you have them in the right order. So pay attention to the order it tells you to put your questions in. So from first to last, based on client's current safety priorities. Again, pause here, just stay on this screen so that you can look at these and then just determine which order they need to go in. Answers on the next slide. And here are your answers. You can see it's number 1, ensure the bed alarm is working. Number 5, reposition client and check for skin redness. Number 4, offer hygiene and encourage turning every 2 hours. Number 3, verify need for continued catheter use. And number 2, communicate changes in safety status to RN. And we're finally at the last question. The last question, just like the last step of your nursing process, is always to evaluate. So I've seen the cues, I figured out what the cues meant. I came up with what might be wrong, I came up with what I could do, and then I actually did it. Now you evaluate it. Did it work? If it worked, great. We're moving on to the next problem. If it didn't work, you're starting all over at the beginning and going, okay, what didn't work? So recognizing those cues and you start all over. Different than the select all that apply that we had earlier, which did not tell you how many you had. This is called a select all that apply in for number. You know that because it says which 3, so it tells you very specifically how many you should select. Which 3 follow-up findings indicate that risk reduction interventions were effective. And I'm going to, again, ask you to pause here, look at these, determine which 3 indicated that the risk reduction was reduced. So did it reduce the risk reduction to have the client remain in bed with the call light in reach? Does that reduce the chance of risk to the client? So again, turn these into a yes, no, a true, false statement and answer all of them. Anything that is yes or that answers the question, yes, it reduced the risk, you keep it. If it didn't, you throw it out. So here we are. Your answers are client remains in bed with call light. The skin is intact. Urine is clear with no signs of infection. These all demonstrate success in fall prevention, skin integrity, and CAUTI prevention. Findings like resisting repositioning or leaving the catheter in too long without need show room for further intervention. So these are your correct answers. Congratulations, you have now successfully completed your case study. Thank you so much for watching this presentation of the Reduction of Risk Bootcamp on the Go. These are your NCLEX Success Specialists. So whether it's me or Christina, Tahira, or Jesse, I encourage you to reach out to us for further needs, for questions, for continued preparation for your NCLEX. Remember, safety first, critical thinking always. Best of luck on your NCLEX.